Dear students, today we'll be learning about the sectional anatomy of GI and how to understand and how to interpret a section, and this understanding will be helpful for understanding of CT scans and MRI scans. And now going in, we need to look in that. First of all, this is a very important slide. They always say when we are looking into any section, that's a standard practice. We always look inferiorly. We are looking from below and we are looking up. What's the logic behind? The logic behind is this is a standard method of looking into each section, and each section is taken that way, and that is exactly matching when a doctor is examining a patient, and that is his exact position. And now this image shows us the same thing. When we are looking at into every section, we should be looking from below and we are looking upwards. We are not looking downwards. And then we need to keep an orientation. This is our front, so this is anterior, and behind is the posterior, and that's the right, that's the left, and then this is the medial and that's the lateral. Guys, this is an orientation when we are reading these sectional images, and that's a standardized thing, and we need to be good about those things. Now you're provided a section, and there are certain, so how I learn this section and how should I talk about it? First of all, when I'm looking into a section, the important points which makes me understand things, which view. So I have to orientate myself. So orientation I can get from here. That tells me where is anterior, where is posterior, where is medial and where is lateral, where is right and where is left. And then what sectional level we are cutting this human body. So this T12. So these two images are important in understanding this image. And then now I'm sure for, so now still I'm struggling with, maybe I can identify some of the things, but I may not identify the other structure. So now let's build this image. How? Let's place one by one each structure and let's start our journey through the process. So now we are looking at the first thing which I have introduced here is the vertebrae. What is important for us? The body should be facing anteriorly and the spine should be facing posteriorly, and the spines will go transversely. Now we have embedded this vertebrae into a body cavity. So body wall has been placed where there is a skin, fascias and the muscles, and if it's a lower rib cage or rib cage, there you can see the bones are visible to you. And these are the muscles which makes my posterior, which are paravertebral muscles. Now we have introduced two more structures. These ovoid structure, these are the kidneys, and then these kidneys have been surrounded pads of fat. They are surrounding them, they are keeping them in their position, and they are not allowing it to move. Can you see a notch is formed here? This notch is meant for some very important structure which we'll be discussing later, but right now we said this is anterior, this is posterior, this is medial, this is lateral, this is right, this is left. So a big structure, a wedge-shaped structure has been shown up here. That is nothing but my liver, and you can see this green thing, that's for gallbladder. And these are the structures, portal vein, other things, we'll be labeling them shortly. Now we have filled in this notch. What is this? This is an area which is thick wall, and it is my aorta. Why aorta is not like a tube? Maybe some branches, this section, we learned that at T12 level. So it is giving some of the branches. You can see this is what? Your celiac trunk is about to be given up. And then there are two lateral branches. So this is at the level, section is taken at the level where branches are taken off. Branches are about to start their journey. And let's put another tube here, which is thin wall as compared to this. You always ask how we compare an artery from a vein. Look at it. How much is the thickness of an artery and how much is the thickness of a vein? This is my inferior vena cava. Now we have add up this adipose tissue, which is full of lymphoids, sympathetic chains and other important structure, but everything is now packed. Let's add more. We have added on the left side a structure, wedge-shaped structure, that is my spleen, and then transversely going in the middle, that is my pancreas. And there I have added more structures, so some part of my omentum, and this is the duodenum which has been showing up. The first part of the duodenum we are looking at. And then we are looking at more structures, so we are looking at the colon, and there you are looking at, this is the colon, and this is the spleen, so splenic flexure, and then stomach is about to come within this image. So you can see there the transverse and the descending colon. Both of them has been shown up in this image. Now we are adding up more. Things are getting almost. Now we can just recap. Look at the vertebrae, look at the kidneys, look at the aorta, look at the inferior vena cava, look at the gallbladder, pancreas, duodenum, transverse and descending colon, liver, spleen. So everything now you can figure out yourself. But you're not supposed to learn anything. Well, what are these muscles? What is this? No need for that. Just stay focused for your own defined area. So now orientation. This is anterior, this is posterior. What level? T12 level. So if you cut a human body at T12 level, why we need to learn about levels? Guys, people have different heights, but the vertebral level remains the same. No matter someone is 6 feet tall or 2 feet tall, it's the same. So levels are remaining the same structure. So now let's go to another section. We have the orientation, we have the level. What level is this? T10. And we are looking from where? From below upwards. So now a huge liver showing up, inferior vena cava, hepatic veins, aorta. Which aorta? Abdominal aorta. Excellent. Look at it. The fundus part of your stomach, the rugis. Look at it. Esophagus becomes here. So this is the cardiac end of the esophagus. And there, look at it. This is the stomach, the fundus part. And there is a spleen. What are these crescent shaped structures? These are the lower part of my lungs. Going further, lungs are almost gone. Liver becomes huge. Inferior vena cava, look at more of the hepatic veins. Look at the spleen and look at it. Now, stomach, almost we are down. We are down at what level? We are at T11 level. Look at stomach. Guys, all numbers has been given below, but you're not supposed to put your time for these numbers which are in periphery. Just stay focused. The things which are related for your immediate understanding. Going further, we are at T12 level. Now you see the liver and look at it. You can see the portal vein, bile duct, common bile duct and the hepatic artery, and then other structures. Kidneys are well marked, spleen is been showing up. And what is this number 5? Any idea? This is the body of the stomach, right? And what is this 27? Any idea? 27 is the body of the pancreas. So pancreas is about to show up. Pancreas is about to show up, but not has been clear as yet. And what is this number 6? That is the left colon, which is showing the towards the spleen. It's a complete thing. So it is hepatic flexure, splenic flexure or left flexion, right? So this is how we can understand the different levels. Now we are going down T12 and L1. Things has changed. Look at this. Liver is now decreasing. Spleen has become very minimal. And there is the fossa for gallbladder, and this green thing is the gallbladder. Look, inferior vena cava is out. And what is this 26? Any idea? Is the portal vein. And what is this number 23? Guess about this. This is T12 and L1. What is this 23? 23 is my left renal vein, which is about to join the inferior vena cava. 22 is my aorta, abdominal aorta. Kidneys, well marked, spleen. And what are these number 7? Jejunum, perfect. What about this number 5? Any idea? Number 5 is my transverse colon. And what about this number 9? Quickly, descending colon. Excellent, you guys are smart. Now see that. We are at L2 level. Liver is almost gone. Kidneys are seen. These are the muscles which are behind my kidneys. We will be learning about them. Relax at the moment. But one of them is psoas major. You remember we learned about psoas major muscle. So now look at it. These are the loops of the intestine. And then this, what is this number 4? That is my transverse colon. So now look at the structures which have been coming up in this area. Right? So we need to be, you can map with these and you will understand everything. Now we are at L2 level. We talked about that already. Now we are at the lower level L3. Changes. What changes we are looking at? We are looking at so many tubes. What are these 31, 31, 31, 31? Any idea? Transverse colon. Transverse colon. And what do you think 29? On the right side. Ascending colon. Excellent. So if we go on the left side, what you can see this number 5, number 5, number 5, number 5. What is this number 5? duodenum. And this number 4 is ileum. Are we good to that? And what is this number 25? 25 is my duodenum. And what about this area? This is the attachment of the mesentery, from where we have the mesentery which continues and it loops all the small intestines. So you get so many jejunal and ileal arteries which have been shown up in there. Are we good? Kidneys are, where are the kidneys? Any idea? Can you see the kidneys? No, we are looking at this muscle, psoas major. Well defined. Kidneys are gone because we are at L3 level. So guys, this ends this thing. It has a lot below, but this much is needed for you at the moment. Thank you very much.